Honorable audience, it's my pleasure to be with you today. I am Maryam Benani. I will report the experience of pharmacology and nephrology services of University Hospital Hassan II about dosage fluctuations in kidney transplants, benefits of therapeutic drug monitoring of calcineurin inhibitors. The success of the kidney transplantation, which is the only alternative for chronic renal disease, relies on immunosuppressive drugs that are neuromargin and lead to many side effects. So how can the TDM be the only solution to avoid them? This study has an objective is to highlight the benefits of TDM in optimizing immunosuppressive renal therapy in renal transplants, to guarantee efficiency, to avoid toxicity, and to prevent rejection. It's about renal transplant recipients. There were 35 patients and we analyzed more than 1,000 samples of residual concentration of calcineurin inhibitors for over than 15 years. We carried on biologic analysis for renal function, hepatic function, and others. Also, we used an immunologic analytical method to analyze our samples. And the statistical study was done with SPSS and ARSED. This statistical study allowed us to gather significant information about the assays performed, correlation analysis between dose and drug blood level, and co-medication and drug interaction. The measurement of association between drug blood level and pathology were analyzed by the probability P and correlation R. The test is considered as significant if P is less than 0.05. The result shows for sociodemographic characterization of renal transplant recipients that in our population, men represented 72%. Most people were aged between 20 and 40 and had a university degree. The majority was non-smokers and has a medical insurance. 52% was Amazigh. The patient's personal background shows that the most of our patients were suffering from renal disease in 34%, followed by hypertension. And 40% of family members were suffering from diabetes, followed by renal disease. For the pharmacology part, we discovered that tacrolimus is the more prescribed drug, 58%, followed by cyclosporine and 40%. The correlation analysis between dose and residual drug blood level demonstrates, according to correlation indicator, there is no relation between dose of immunosuppressive drug and its drug level concentration. In 93% and 84% for tacrolimus and cyclosporine respectively, highlighting once again the importance of therapeutic drug monitoring. The result of analytical steps shows that 38% of dosages was over the therapeutic margin and only 25% was in efficiency window. We unfortunately had 3 rejections of the grafts, and we could explain one of them, that was pharmacokinetic one, depending on renal toxicity induced by tacrolimus. Analyzing the main side effects of cyclosporine shows that the most important ones are gastric disorders, followed by hypertrichosis and gingival hypertrophy. For tacrolimus, it was the diabetes induced, followed by gastric disorders, hypertrichosis, and gingival hypertrophy. All these side effects lead to sandwich, especially for cyclosporine. To conclude, anti-calcineurin inhibitors are neurotherapeutic margin, requiring a rigorous therapeutic drug monitoring to avoid all the side effects of these drugs and toxicity for the grafts. What's next step? We are studying pharmacokinetic profile for all renal transplant receivers. It's the first study in Morocco and Africa. This study will help us to figure out in Moroccan population all the genetic factors, the pharmacokinetic characteristics, the drug-drug interactions, and the drug-food interactions. And thanks for your attention.